And welcome to the Business Spotlight. This is Pat Dewar. I have a great show going today with Dr. Mary Swift. She's the 2011, 2012, and I just found out that she's the 2013 Consumer Choice Award winner in the Dallas area for cosmetic dentistry. It's going to be a real treat today because we're actually going to start down a path that is, well, may hit home for a lot of us. And Dr. Mary, one, thanks for being on the show again.
Thanks for having me.
Second part is, my dad lost his teeth when he was probably 48. My mother lost enough of her teeth that she had to wear a bridge the rest of her life. And it was probably in the 49, 48, less than 50.
Am
I going to have that?
Yeah, I knew that's what you were going to ask, and it's a good question.
Yeah.
Genetics weigh heavily in our dental oral health. Teeth are made up of the same thing as hair and skin, ectoderm. So the quality of your hair, the quality of your skin, the color of your eyes, the strength of your teeth, the tendency towards gum disease, genetically predisposed. Now that doesn't mean that you can't put up a good fight and keep what you have, and certainly the fact that your folks lost their teeth, without a history of why, was it the kind of care that they received and that was just what was done, take it out instead of trying to save it, or was it gum and bone disease and or decay that caused the tooth loss? Either way, I hear your concerns, and I think it would be good to review for everyone why that happens and what to do when it happens, and how to survive, basically.
Sure.
Because it's loss of a body part.
Well, and it is pretty damaging. I mean, your own teeth, we've talked about before. You want a faceless smile.
Yes, yes.
But if you're embarrassed by your teeth,
right, and the nutrition part of it. Digestion starts in the mouth, and especially the older we get, the more important it is to be able to chew and crunch and get that fibrous food to keep everything healthy all the way down. And it's heartbreaking when someone advanced in years has to get used to a whole different feel in their mouth, and we see health plummet when that happens. So I would love to go over with our viewers how to set yourself up to have the best health because you have the best teeth,
right,
for the longest amount of time. And it's not unrealistic, and especially kids nowadays, there's evidence that they're going to live well into their hundreds. Well, I read those kind of articles that kids today are going to live to be like 100. I mean, that's not an unrealistic goal for kids today. And I'm seeing what my 90-plus-year-old patients look like dentally, and I'm a little worried for the kids.
Oh, yeah.
I want to make sure that moms and dads and even if you're taking care of an elderly parent, how you can go about making sure that that's not going to interfere with their whole health, that the health of their mouth is not a contributing factor to their health demise.
Absolutely.
Over the years.
So, if you're sitting there trying to tell somebody like me, what can I do? What are some of the first steps?
Prevention, always, and that
just floss the teeth you want to keep?
You've seen that plaque.
I had a dentist tell me that.
Yeah.
I was like, is there
funny,
a better?
Aren't we?
Is there a tip you can give me on flossing? Just floss
and preventive care in the dental office. And that should be personalized. If you are the kind of person that grew up going to the dentist every 6 months, you don't have a single filling in your head, and your gums and the surrounding bone are in excellent health, then twice a year is all you need just to go in and visit with your hygienist and catch up, you know. But if you have a tendency towards gum and bone disease, and if you don't know if you have a tendency between gum and bone disease, I'm even a little more worried, because you should know. Right. And I'd like to go over how you should know.
Sure.
But getting into the dental office so that we can tell you, basically, is how you know. Every patient should be examined uniquely and questioned about their family history, because it does play a part.
Now, we got another minute or so. I want to look at, when you look at somebody's teeth the first time, and do you X-ray it? What are some of the components that begin to build the information you need?
Right. It's pretty standard to get a series of X-rays, and then the first step should be, if there aren't any pain concerns, you know, then it should be going through and checking out the gums and the surrounding bone with X-ray examination and a cleaning, and getting a plan together. And that's what I'd like to talk about next, is how we should approach a plan for everyone's specific position in life, a plan to get them to the end
with all
a
their
full
teeth.
set of teeth.
Live to 100 and keep the
And
pearly
keep your
whites.
teeth.
Well, this is the Business Spotlight, and what we're really talking about is putting together a plan that any client should have with their teeth, so that you get to keep them. Because I know that if you're like me, I'm 50 something, and my parents lost them. Do you have to? This is the Business Spotlight. We'll be right back.
You can become a published author. Discover a system that will lead you from idea to having your book on the bookshelves. Bob Baer pulls back the curtain at the More Power to Publish workshop. Watch and learn how to follow the step-by-step plan to turn your idea into a published book. Learn more at morepowertopublish.com.
Welcome back to the Business Spotlight. I'm Pat Dewar. Today we're talking with Dr. Mary Swift about, well, losing your teeth, or maybe I should say helping you keep your pearly whites. Dr. Mary, we talked about last time, my dad lost his teeth early, in a sense, 40-something, 48.
That's early.
Is that something you see very frequently today?
Less and less, and that's the good news. My profession has done a really good job over the last 50 years of promoting preventive care. I mean, the oral health, over-the-counter, grocery store, drugstore industry is huge. I mean, everyone wants the products and the magic bullet to, you know, freshen their breath and clean their teeth. So I love that. I love that we're all aware of our teeth and our smiles. But the number one reason for tooth loss is gum and bone disease, and it's so silent. It's a slow, progressive, silent disease that sometimes people don't even know that they have bone loss around their teeth until it's too late. There was an ad in the 50s about pink in the sink. If you brush your teeth and you rinse and you spit out and there's a little blood in the sink, you know, something's wrong. If you washed your hands and there was blood, you'd be looking for something wrong.
Yeah,
Okay.
exactly.
So it's like the number one, you know, something's going on clue is a little pink in the sink. Now, the gum and bone disease that is so silent and so destructive is the primary reason why people lose their teeth. Okay, sometimes it's decay, but realistically, we can remove decay, fill it, and fix it.
Right.
Gum disease is entirely different.
So what do you do for gum disease?
It's like being a diabetic. You
Right.
literally have to modify your lifestyle, make some changes to improve the chances of keeping your teeth and battling this gum and bone disease.
Changes. What kind of changes?
Cleanings by a professional hygienist 3 or 4 times a year.
Really?
Yes.
Really?
That when you have bone loss, your gums are staying where they've always been, but silently the bone is creeping down the tooth. You can't reach that. Your toothbrush is on the
I see.
above
So the
the
gum
gums.
is hanging over, in a sense. It's kind of like
it takes
our bellies.
our little instruments to get in there and clean it up. It's all about bacterial count. It's all a numbers game.
Oh.
The more often it's like if you were a diabetic, you had an open wound. That wound requires more care to heal. Okay,
Right.
So you've got nooks and crannies that you can't reach that the professional can. To keep the numbers down, to slow, I'm not even talking stop, the progression of bone loss. So it is unfortunate, but if you have a tendency towards gum and bone disease, you have to actively battle. Yes, like your waistline. I heard you.
Well, it's
You
that
have
whole
to
thing. You know,
change a few
it's kind
things.
of hanging over there, but it's just that it's getting. Is it a? It's just loosening? What's happening?
And it's truly, and they're working on a vaccine, if you can, because
Nice.
it is a bacterium, a specific bacterium. Everybody has it. It's just that if you have a tendency towards gum and bone disease, you're more sensitive to it and it does more damage. So it is about controlling that bacterium in your mouth and keeping the numbers down. Now, okay, let's say, like your dad, we ended up having to lose teeth.
Yeah.
Okay. It's not the end of the world. You know, we've got ways of, making things better and fixing and replacing. And I would love to go over those options.
Go for it.
But for this segment, we're sticking with how do you get rid of that gum and bone disease, and that's going and having your teeth cleaned more frequently. Now, what I get the most of when I'm telling patients this is my insurance only pays for twice a year.
Oh.
You can imagine what that does to us dentists when insurance dictates care. It'll cause many a heated conversation in a room full of dentists. So,
Sure.
And what I tell my patients is we won't do X-rays on that visit. We can skip the exam on that visit. Come in, just let us clean you.
Right.
And it's about what you'd pay for a haircut, okay? And it's your teeth, okay?
Nice.
Yes. You got to kind of put it in perspective, and people they get it when you
Right.
put it in perspective for them.
Now, can they do anything else at home?
I would say if you do what your dentist tells you to do at home, because just everybody's got special needs, and your dentist or hygienist should be able to customize what tools and products you need to use for your specific situation.
Because we did a thing a while back, and we got a special toothbrush that did treat the gum a certain way. So it was. I know that there are little things like that that can help, but you've got to do.
Yeah, you got to know. You've been to my office, so
Yeah.
you probably do know your bone level at 6 points around each tooth. Remember when she did that? The hygienist took and measured. That's what I'm saying. You should know your bone levels. At a good appointment, a good dental hygiene appointment, they're going to take 6 little points of measurement around each tooth.
We'll be right back. This is Business Spotlight.
You can become a published author. Discover a system that will lead you from idea to having your book on the bookshelves. Bob Baer pulls back the curtain at the More Power to Publish workshop. Watch and learn how to follow the step-by-step plan to turn your idea into a published book. Learn more at morepowertopublish.com.
And welcome back to the Business Spotlight. Today we're interviewing Dr. Mary Swift of Dallas Laser Dentistry, 2011, 2012, and 2013 Consumer Choice Award winner for cosmetic dentistry. You know, we've been talking about tooth loss. And I started with my dad. He lost his teeth early. If somebody did lose their teeth, what are the steps that they could do? Do they just have to put the plate in and adjust?
No.
Good.
Yeah, good. It's exciting in dentistry right now. We are turning more into orthopedists every day with our ability to replace missing body parts. You know, if you lost your foot and somebody made you a replacement, you would hope for state of the art.
Right.
And we know that that's what patients want in their mouth also. We've got exciting, we call it all on four. I don't want to get too technical, but if somebody has to lose all of their teeth, there is a way to permanently, I'm not talking about something that you take out and put in a jar at night to go to bed. It's literally permanently screwed in on dental implants to replace all the missing teeth. Implants are the best way, in my opinion, to replace missing teeth. And I want to kind of talk about your dad because he lost his teeth early.
Sure.
In dentistry, that's early, okay. And one of the hardships with losing teeth early is teeth hold bone in the arch. When you lose teeth, the bone resorbs away. And when you lose teeth early, later on in life, you don't have anything to hook onto, anything to hold that denture in.
Oh, really?
So it's much more of a concern for us in dentistry when somebody loses their teeth early. Because if you can even picture this, on the lower, if you've got a denture sitting on that ridge and that ridge resorbs away, you end up actually pinching a nerve, the nerve that goes all the way, and then you can't wear anything. So it snowballs.
Wow.
Good news nowadays, when we lose teeth, we know that implants placed hold bone in the area
Right.
better than teeth did. Especially in someone that has gum and bone disease. You don't develop gum and bone disease around implants like you do around teeth. So it's a great solution for tooth loss, implant placement.
Now, I know that if somebody has cancer, though, that a lot of times in the past, they've just literally gone in and said...
Head and neck cancer, it's a devastating diagnosis. And thank goodness we have excellent specialists and early on, that diagnosis meant full mouth extractions.
Right.
When you got a head and neck cancer diagnosis, you went in to preventively remove all teeth because teeth have nooks and crannies that hold bacteria and you want to hold down on infection. So they would just, I mean, it's not done that way nowadays, thank goodness. Medicine and dentistry both have gotten smarter and more efficient, and there may be some partial tooth loss, but there's good results with recovery, that you can go in and actually put more bone back in the area if you need to, and then implants to replace missing teeth. So, it's a long haul, and it's a lot of planning, and a lot of time in the office, but you can get some amazing results.
Sure, because you get actually at that point, you can almost design the smile that you want completely, can't you?
Exactly, exactly. So, you know, so it can...
I want Tom Cruise's teeth. They just... He spent a minute on his,
Hollywood
I know.
smile.
Really?
Yeah. So it's a devastating diagnosis, of course, you know, but could you imagine having to live with the ravages afterwards if we didn't have what we have nowadays?
Well, and if anybody's ever lived overseas, they've seen people that have not had the benefit of
if you've traveled overseas and you're an American with an American white straight smile, they pick you out of a crowd. You're an American.
Yeah,
they can tell by your teeth. We are obsessed with our teeth and our smiles. But you know what? That's my number one beauty tip. Ask me.
That's right.
Ask me what my number one beauty tip is.
What is your number one beauty tip?
Just smile. Everyone looks better.
Yeah, it improves everything, doesn't it?
It does.
So, you know, up till now, we've really just said, okay, genetics.
Genetics.
Check it out. Mm-hmm. If you have it, 4 times a year, you should be in a dentist.
If you have it, yes. Even if your insurance only pays for twice a year, yes.
You guys work with them.
And if it's been a while since you've been in the dental practice and had your teeth cleaned, it could take several appointments to catch up. Okay, so don't be surprised if you've stayed away from the dentist and you finally can make it in, that it might take a couple appointments to get things caught up and cleaned up.
Yeah, having done that before, I do know that feeling. You know, it's that, oh, you got 11 extra holes in your head. Thanks.
Oh.
It was okay. 3 days later, I couldn't taste anything. So this is a business spotlight. We're really talking with Dr. Mary Swift about ways to keep your teeth. And when we come back, we'll give you more tips and tools of things you can do. This is the Business Spotlight. We'll be right back.
You can become a published author. Discover a system that will lead you from idea to having your book on the bookshelves. Bob Baer pulls back the curtain at the More Power to Publish workshop. Watch and learn how to follow the step-by-step plan to turn your idea into a published book. Learn more at morepowertopublish.com.
And welcome back to the Business Spotlight. This is Pat Dewar. Dr. Mary Swift is my guest today. And we're talking about how to, well, not just keep your teeth, but if your parents, like mine, lost their teeth at a younger age, under 50, and that used to be fairly common, what do you do about it? Well, we've been talking about things that you can do. This time, Dr. Mary, the solutions that you mentioned is permanent implants.
For
right?
replacement, yeah.
Replacement.
So if you have to lose a tooth or several teeth or all your teeth, know that there's more than one way to replace them.
Right.
Okay. The Cadillac, I don't know if that's the fanciest car anymore, but the Cadillac is the implants. Okay, implant replacement. And even within implant replacement, there's everything from just putting 2 little bitty implants and snapping a full denture on,
Right.
to an implant for every single tooth that needs to be replaced. It's very expensive, but it's relative. Okay, if you have to spend the last half of your life
Right.
with the replacement of a prosthetic replacement of your own teeth, that's a lot of time to spend in something that isn't perfect. And the best way to get the most realistic replacement of your own teeth would be implants.
Right.
Okay, but they are expensive, okay, and I completely understand that not everyone is going to be able to go there. So there's other ways to replace missing teeth. If you are missing not all of your teeth, but a few, you can do crown and bridge work
Right.
to replace the missing teeth. We've had crown and bridge work in dentistry for over 100 years. We've got a great history with crown and bridge work, a little longer than that actually. Whereas, you know, implants not as long. We're getting there, but so it's not that much of a lesser option.
Right.
But it's not as realistic as your own teeth as implants would be. But you've got crown and bridge replacement, and it's again not something that you have to take in and out. It should be permanent in your mouth. So there's an advantage there. And then even if that's more than the patient can afford, you can always do something removable. Okay, so it does come out and go in a jar at night, but you replace the missing teeth, you stabilize the arch so things don't drift around, you don't drill on any other teeth like you would in crown and bridge replacement.
Right.
So if you did something that just comes in and out, you could come back at a later date when you win the lottery or get that big promotion and then do the implants. So the best thing you can do if you can't afford the implants right now is to at least do something so it doesn't get worse.
Right.
So that maybe someday you can go back and do the implants.
But you guys do a lot of that at your office, though. You actually put together a plan, and it could end up being, well, eventually we want to do a full mouth, you know, if they've lost all their teeth, replace them all.
Yes.
But you can build to that potential, is what I'm hearing. Is that what you just said?
And on top of how do we get you the healthiest we can right now? How do we make sure that that lasts your lifetime affordably? How do we do all that and stay where you are in this world, affordability-wise, and develop a plan? And you know, even looking at the patient's benefits, we love the end of the year in dentistry. We get really, really busy along about November because everybody's looking and going, oh, I've got benefits I haven't used yet, which actually helps with a larger treatment plan, because if your insurance benefits re-up at the end of the year, then you use your max, you know, for November and December, and then you pick up again in January and February, and you finish the treatment plan out.
Oh, so you could do that.
Yes, oh yes,
Very
and
nice.
so we plan to get this bridge over here paid for on this year, and then next year when your benefits re-up. You can't always do that, but it's, you know, it's one of the nice things you can do for your patients is look at what they need, where they are in life, where we want to be when you're older, and make it all work. A long-term relationship, you know. It shouldn't be just let me fix this and see ya. It should be let's look at this for where we're going to go with this.
Well, and then you do a lot of planning as far as, I mean, somebody does come in, and recently we had a mutual friend come in, and they needed something immediate. They were in pain.
Yeah. Oh, we'll get you in. If you're in pain, you should be seen immediately. There's no excuse there. And yes, so there's a difference between taking care of an immediate need and a long-term plan. And hopefully we do good at both for our patients and the public.
And I know that you're probably planting a lot of seeds in the fact that you see, while you're there, while you're looking under the hood, you see the rest of the story,
and
don't
like
you?
we talked about earlier, you know, what I see my 90-plus-year-old patients looking like gives me a real clue as to what I should be looking for and including in the plan for my existing patients. You know, and replacing missing teeth is one of the biggest things you can do to maintain the integrity of the dental arch. When you lose a tooth, the other teeth drift around and everything shifts and migrates into the empty space, and it's a snowball effect that happens, progressively worsens throughout the years. So replacing missing teeth is very important in keeping the rest of your teeth healthy.
Well, Dr. Mary, it's always a pleasure to have you here. We always learn so much. Folks, if you're in the DFW area or in North Texas, or shoot, if you're in the country and you are looking for a great cosmetic dentist, I have been to her office. I'm a client. I love the ways that she works with her people. You should call Dr. Mary Swift right away. Visit her website, check them out. They have solutions to help you keep your teeth. And I'm real thankful that I get to work with her. So we'll talk to you all next time. This is the Business Spotlight. Thanks.